What's up, well, welcome back to the channel. Hopefully you guys are staying safe wherever you are. I know I haven't been posting a lot of physio content in the past month or so, but we are back at it. A lot of you guys have been messaging me about placements, so I thought, you know what, why not make a video about that? With that being said, if you guys want to know more about the course structure, exams, interviews, and what it's like to be an international student, then comment down below because I want to tailor my content to you guys. This video is applicable to everyone that's studying physiotherapy around the world, whether you're in the UK, America, Canada, Australia, because I'm drawing my experience from different fields of physio, including musculoskeletal, neurology, and cardiorespiratory. Tips I'm going to give you are not necessarily in your marking scheme because I want to focus more on the attitude and mindset towards placement. And these are things that I found super helpful in accelerating my development as a student and a future clinician. And by no means I'm saying that you can't get good grades without these tips, these advice. All I'm trying to say is these are things that I found useful and these are things that I want to share with you guys. Let's jump straight into it. First thing first, keep an open mind. I know a lot of you go into physio thinking you want to be a sports physio, you want to be a musculoskeletal physio, but honestly, go into your placement with an open mind. If you feel a certain placement isn't really in your preferred area of interest, don't worry, go into it. You might be surprised. For me, I was just as enthusiastic going to my inpatient acute stroke placement in comparison to my private MSK placement. At the end of the day, no matter what the clinical setting is, you're helping people and you're making a difference in their lives. I found my acute stroke placement extremely rewarding. One of my patients was literally like, James, you brought half my body back to life. You inspired me to move again. And I was like, wow, like this is something special. Like I'm making a huge difference here. Something you might not experience in the MSK setting, but then again, in an MSK setting, you will be helping people, curing people with possibly years of back pain, neck pain. So it's different kind of satisfaction. One important piece of advice I got from my university mentor during my placement was that even if you don't enjoy that area, pretend that you do. I know it sounds kind of bad, but it is true. Be curious, explore it, because you might not know, you might end up liking it. So always be positive and keep an open mind. Second of all, find your fear of making mistakes and literally, ciao, throw it away. Being afraid to make mistakes, especially in front of educators that are going to grade you or even potential employers, is completely normal, but that is something that will hold you back in your placement. Now is really the time to practice your skills on real patients, and yes, you will mess up, but that's how you learn. Being confident doesn't mean that you think you're the best, you think you're perfect and you know everything. It means that you have the courage to try new things, try new skills, and be okay with making mistakes. The bottom line is everyone makes mistakes. You do, I do, physios do, so get over that fear. Third tip is to know that you're not expected to be performing at a junior physio level, at least not in your first, second, or third placements, because you're still a student and nothing will kill your confidence more than expecting to have entry-level skills during especially your first or second placement. So honestly, those two placements are for you to familiarize yourself with communicating with the MDT, outcome measures, note writing skills, muscle strength testing in different positions, and also familiarize yourself with how the hospital system works. You gotta know that your educators know what level you're at as well, so definitely aim to develop as much as you can during your placement, but remember that there's still so much to learn. There's always so much to learn. Even if you're a physio, there's always so much to learn. So as long as you're giving 100%, then you're doing fine. Right, tip number 4 is to remember that you have got a valuable perspective to offer to. Your educators undoubtedly know more than you do, but it is possible that you know something that they don't. If your educators handle the situation differently than what you would have done, don't be afraid to talk about it. Ask them why they did what they did. As long as you discuss these differences in an open, professional, and collaborative manner, you'll be surprised that your educators would actually be appreciative hearing what you read over the weekend. Remind yourself that your clinical reasoning and evidence-based opinion is just as valid as your colleagues. Bear with me, we're more than halfway done now, okay? Fifth tip is to ask for feedback and be reflective. Don't wait until you're halfway assessment to reflect on how you're doing. Honestly, for me, after every single treatment, I would ask my educators, how did I do? Is there something I could have done better? And towards the end of the week, I will reflect on what I have learned, what I want to work on the next week, and how I'm going to do that. Always ask yourself, am I on track with my learning plan? I know it might be harder for some of you guys than others, but swallow your pride because constructive feedback might not be pretty. But it's super important to listen to those feedback and then be proactive in actually making a change. We are almost there. Tip number 6 is to write notes. You guys probably already know this, but try and write down what you have learned because you will forget at least some of it by the end of the course. The CSP CPD e-portfolio God, that was a mouthful. Has a lot of tools and spaces for written reflections, and what I do is I write down questions to ask my supervisor at the end of the day, things I want to look up later, such as conditions I'm seeing for the first time. I would also write down future project ideas, as well as some courses your educators recommended you taking once you graduate, so such as the acupuncture course or the manipulation course if you're interested in MSK. Final tip is to take a proactive interest. Get involved with any fundraising, CPD, staff days or surgeries, wherever possible. Take a proactive interest in the workplace. In the future, you might have an interview in the same place. You never know. For me, during my placement at Imperial College NHS Trust, I was actually involved in a music therapy project where I was teaching, me and other colleagues were teaching patients how to walk again. Always take initiative, because really this encompasses it all. You will benefit so much more from the placement if you take responsibility of your own learning by asking questions, preparing for each day, and seek out hands-on experience. Don't be a passive learner, be an active one. If you want to learn something new, speak to your supervisors because they will guide you through it. If you want to see a certain type of condition, speak to your supervisors because they might be able to keep an eye out for you. If you don't know why or how your educators did something, ask them. If you want to plan a treatment for your patient, ask your supervisors to give you a good patient to try it on. If you want to take a full subjective history on your own, don't be afraid to ask your educators whether they are comfortable with stepping back and giving you a shot. And honestly, this has happened to me so many times. Ultimately, the last thing you want on your placement is a really long job shadowing. Okay, I gotta come clean. There's actually one more final tip I want to give you guys, is to have fun. Your first placement might be a bit nerve-wracking, but it is an amazing experience. This is your chance to put all your hard work into practice, help people in need, and these are real patients as well, and not just scenarios you would learn from your books. I can safely say, and I'm sure everyone would agree, you actually learn a lot more, a ton more during placements than you would do in uni. You finally get to practice what you want to do for the rest of your life instead of sitting in a classroom talking about it. So don't overthink during your placements. Take good care of yourself mentally and physically. It could be quite overwhelming sometimes, but have fun. Enjoy it. All in all, I know placement grades are obviously important, but the experiences you gain are absolutely invaluable and have a greater impact on your career. Hope you guys find this video useful. I hope these tips can help you through your placements. If you guys are still here watching this video right now, thank you so much. You guys are the real OGs. Let me know in the comments down below what you want me to talk about next. And of course, subscribe if you haven't already. And I'll see you guys in the next one. Peace out.